Non-communicable diseases, NCDs, also known as chronic diseases, are medical conditions that are not caused by infectious agents. They are typically long-lasting and progress slowly over time. Unlike communicable diseases, which can spread from person to person, NCDs develop due to a combination of genetic, environmental, and lifestyle factors. In this content, we will explore various aspects of NCDs, including their causes, types, prevention strategies, and impact on global health. 1. What are non-communicable diseases? NCDs are chronic conditions that arise from non-infectious causes and cannot be transmitted between individuals. These diseases often develop over many years and are linked to risk factors like poor diet, lack of physical activity, and exposure to harmful substances. NCDs are responsible for a significant portion of global deaths, with the World Health Organization, WHO, estimating that they account for over 70% of all deaths worldwide. 2. Types of non-communicable diseases. The most common types of NCDs include cardiovascular diseases, such as heart disease, stroke, and hypertension. These are diseases affecting the heart and blood vessels, often associated with high cholesterol, high blood pressure, smoking, and lack of exercise. Cancers. Uncontrolled cell growth in various parts of the body, often influenced by genetic factors, lifestyle choices, or environmental exposures. Common cancers include lung, breast, colon, and skin cancer. Chronic respiratory diseases, like chronic obstructive pulmonary disease, COPD, and asthma, these affect the airways and lungs, often linked to smoking, pollution, and occupational hazards. Diabetes. A metabolic disorder where the body either doesn't produce enough insulin, type 1 diabetes, or cannot effectively use insulin, type 2 diabetes, leading to elevated blood sugar levels. Mental health disorders. Conditions such as depression, anxiety, and dementia, though sometimes overlooked, are non-communicable and can have long-lasting effects on individuals and communities. Musculoskeletal disorders. Chronic conditions like arthritis and osteoporosis that affect mobility and quality of life. 3. Causes and risk factors. While genetic predisposition plays a role in the development of NCDs, the majority of cases are linked to modifiable risk factors, including unhealthy diets, high consumption of processed foods, refined sugars, and unhealthy fats increases the risk of obesity, diabetes, heart disease, and cancer. Physical inactivity. Lack of regular exercise contributes to the risk of developing NCDs, as it affects heart health, metabolism, and mental well-being. Tobacco use. Smoking is one of the leading causes of cardiovascular diseases, lung cancer, and chronic respiratory diseases. Excessive alcohol consumption. Over time, heavy drinking can damage the liver, increase blood pressure, and elevate cancer risk. Environmental factors. Exposure to air pollution, toxic chemicals, and unhealthy work environments can contribute to the onset of NCDs. Psychosocial factors. Chronic stress, poor mental health, and lack of social support also play significant roles in the development of NCDs. 4. The global burden of NCDs. NCDs are a major challenge for global health systems, with the highest burden falling on low and middle-income countries. These regions often lack the infrastructure and resources needed to effectively manage NCDs, which exacerbates the economic and social impact of these diseases. Economic impact. NCDs reduce productivity, increase healthcare costs, and push many families into poverty due to the long-term care they require. Healthcare systems. Overburdened healthcare systems face challenges in providing adequate care for both acute and chronic conditions, further complicating the management of NCDs. 5. Prevention strategies for non-communicable diseases. Preventing NCDs requires a multifaceted approach that addresses both individual behavior and broader societal factors. The following strategies are key to reducing the global burden of NCDs. Healthy eating. Encouraging the consumption of fruits, vegetables, whole grains, and lean proteins while reducing sugar, salt, and unhealthy fats can help prevent many NCDs. Educational programs promoting balanced diets should be widely implemented. Regular physical activity. Incorporating at least 150 minutes of moderate exercise or 75 minutes of vigorous activity per week can reduce the risk of cardiovascular disease, diabetes, and certain cancers. Tobacco and alcohol control. Policies such as taxes on tobacco products, smoking bans, and limits on alcohol advertising can reduce consumption and lower the risk of NCDs. Mental health support. Providing resources for stress management, counseling, and mental health services can help prevent the onset or worsening of conditions like depression and anxiety, which are often linked to other NCDs. Air quality and environment. Efforts to reduce air pollution, ensure safe working conditions, and minimize exposure to toxic chemicals are essential for preventing respiratory diseases and certain cancers. Access to healthcare. Early detection and treatment of NCDs through regular health screenings and improved access to medical care can significantly reduce the long-term burden of these diseases. 6. Managing non-communicable diseases once diagnosed. Managing NCDs requires a combination of medical treatment and lifestyle changes. Key management strategies include medication adherence. For many NCDs, medication is necessary to control symptoms and prevent complications. This includes antihypertensive drugs for heart disease, insulin for diabetes, and bronchodilators for respiratory diseases. Lifestyle modifications. Incorporating healthy habits like balanced eating, regular physical activity, and stress management can improve outcomes for individuals with NCDs. Support systems. Building strong support networks, whether through family, community programs, or professional counseling, can help individuals navigate the emotional and physical challenges of living with a chronic condition. 7. The role of governments and organizations. Governments and international organizations play a critical role in combating NCDs through public health initiatives, policymaking, and funding programs. Key interventions include public health campaigns, raising awareness about the risk factors for NCDs and promoting healthier lifestyles. Healthcare access. Ensuring that healthcare systems are equipped to provide affordable, accessible care for NCD patients, including preventive services. Global cooperation. International organizations like the WHO and the United Nations develop frameworks for countries to collaborate on reducing the global burden of NCDs, especially in vulnerable populations. 8. The future of NCD management. As the global population continues to age and urbanize, the incidence of NCDs is expected to rise. However, advances in medical research, technology, and public health strategies offer hope. Wearable technology and mobile health apps, for example, are empowering individuals to monitor their health and manage chronic conditions more effectively. Conclusion. Non-communicable diseases represent a significant challenge to global health, but with concerted efforts at individual, community, and governmental levels, their impact can be mitigated. Prevention through lifestyle changes, improved access to health care, and early detection can reduce the burden of NCDs and improve the quality of life for millions around the world. Addressing NCDs is a shared responsibility that requires ongoing commitment and innovation in health systems and personal behaviors. Non-communicable diseases, NCDs, are an undeniable global health challenge, profoundly affecting individuals, families, and entire communities. These chronic conditions, which include cardiovascular diseases, cancers, diabetes, and respiratory illnesses, are responsible for more than 70% of deaths worldwide. Their prolonged nature and complex causes, ranging from lifestyle choices to environmental factors, make them a multifaceted issue that demands comprehensive solutions. While they primarily result from preventable risk factors like unhealthy diets, tobacco use, and physical inactivity, their impact reaches far beyond personal health. NCDs strain healthcare systems, reduce economic productivity, and exacerbate social inequalities, particularly in low and middle-income countries where resources are often scarce. However, the burden of NCDs is not insurmountable. As the world continues to urbanize and populations age, it becomes increasingly important to implement prevention strategies that address both individual behaviors and the broader social determinants of health. Governments, healthcare providers, international organizations, and communities must collaborate to create environments that promote healthy living, improve access to medical care, and empower individuals to take charge of their health. The prevention of NCDs starts with individual choices. Adopting a balanced diet, engaging in regular physical activity, quitting tobacco, and reducing alcohol consumption. Yet, this must be reinforced by policies and programs at the community and governmental levels. Public health campaigns, better regulation of harmful products, air quality improvements, and investment in mental health support are essential steps toward creating healthier societies. By fostering education and raising awareness about the risks associated with NCDs, we can equip people with the knowledge and tools they need to lead healthier lives. Moreover, managing NCDs once they have developed requires both medical intervention and sustained lifestyle changes. Patients need access to affordable medications and treatment plans that address their specific conditions, as well as support networks that help them cope with the emotional and social challenges of chronic illness. Healthcare systems must prioritize early diagnosis, regular screenings, and individualized care plans that focus on preventing complications and improving quality of life. The fight against NCDs is an ongoing journey. With technological advancements, such as wearable health devices and telemedicine, individuals are becoming more empowered to monitor their own health. These innovations, combined with global cooperation and policy changes, offer hope for reducing the burden of NCDs in the coming decades. In conclusion, while non-communicable diseases are one of the leading causes of death and disability worldwide, they are largely preventable and manageable with the right interventions. A collaborative approach that combines personal responsibility with strong public health frameworks can drastically reduce the incidence and impact of NCDs. The goal is not only to extend life expectancy but to improve the overall quality of life for individuals living with these chronic conditions. Addressing NCDs is not just a healthcare challenge, it is a societal one that requires commitment from all sectors, governments, businesses, communities, and individuals. By working together, we can create a future where the burden of non-communicable diseases is greatly diminished, and healthier lifestyles are the norm for people of all ages and backgrounds.